So welcome back to episode 2 in this little mini course, what is pre-diabetes and type 2 diabetes? Let's just dive straight into that today. So diabetes is a condition categorized by high blood glucose or high blood sugar. It's just when you've got too much sugar in the blood. It's caused when the body doesn't produce enough insulin or can't properly use the insulin it's produced, also known as insulin resistance. It's categorized or diagnosed usually with your HbA1c result, which is a measure of your blood glucose on average for the past 3 months. Normal is anything between 20 and 41 millimole. Pre-diabetes is 42 to 47 millimole. And then full type 2 diabetes is anything 48 millimole and above. On the right hand side there, I've also got an extended chart with some different sort of risk levels or categories at which your GP might start discussing different levels of medication or different types of medication and when certain complications are more likely to occur. Just quickly, want to cover the difference between type 1 and type 2 diabetes. So type 1 diabetes is when your body doesn't make enough insulin. It's caused by an immune system reaction, often starts in childhood. Symptoms come on quickly and is treated with insulin injections. So type 1 diabetics are what we refer to as insulin dependent. They depend on insulin to control their blood sugar. Type 2 diabetes, our body doesn't respond to insulin. So again, that is called insulin resistance. It's caused by lifestyle factors and genetics can contribute. It's more common in middle age. Symptoms develop slowly, usually over many years, and is managed with hopefully lifestyle changes, but for many people is managed also with medication. So some of those lifestyle factors that we're going to cover in more detail and some areas that you'd want to focus on to get your blood sugar back to normal. First is body weight, specifically being overweight, obese, or having a high amount of visceral fat will massively increase your risk. Physical activity, nutrition, there's also lots of subcategories in these topics that we'll get into as well, and then lack of sleep and stress. When we think about remission or reversal or getting your blood sugar back to normal, remember that these are just sort of made up concepts, or they're purely labels for different categories or stages of your blood sugar after you've had a diagnosis. Your blood sugar can move along that spectrum or go up and down with your HbA1c, dependent on many different lifestyle factors that we'll cover, and obviously your consistency with those things as well. Also important to note that some people's bodies respond quicker to changes than others. It's common that your GP will give you an annual blood test. If you have an extremely high HbA1c or you have other health concerns, then you may get a 6-monthly or a 3-monthly blood test to check on these things as well. There's a lot of debate and argument about there on what remission or reversal is, or if they are even a thing. What there's not an argument about is on the actual numbers themselves, and you can't argue with getting your HbA1c back to normal and decreasing your risk of those complications. So that's what we care about, that's what we want to do. So make your way through these videos to learn how to do that. Subscribe, and I'll see you in the next one.